Research community link. Number 12, emerging adults W mental illness. Clip 1, breaking the cycle.
When we think about how do we break this cycle, well, there's a couple of ways. From some of the research I've been doing, what we have found is that support, so having some type of support system that you can lean on is very important, because without any support, then you're stuck to deal with these things on your own. And when you're experiencing these symptoms, a lot of times it's just hard to try to manage it on your own. So having a support system is important. We also found that for people who are living with mental illnesses, having some type of transportation services to be able to take them from where they are to the needed care, wherever that facility may be, that is a big thing that have come out in the research, particularly in focus groups with emerging adults who have been suffering from mental illness. But also, and I used to intern at one of these drop-in centers. And so I interned at a drop-in center at a facility that serviced individuals who were living with a severe mental illness. And it really was almost like their home away from home. This is a place where they can come, be around people who are similar to them, who they get along with, but they had clinicians on staff that can work with them. They had game rooms. They had different groups about how to better live, how to navigate the hospital systems, how do you get connected with mental health providers. And so they had so much support at these drop-in centers. And so I feel that having more of these drop-in centers in areas where there are high rates of mental illnesses will be another way that we can break this cycle, because they need help, and so another thing I would like to say is that we need relentless and sustained engagement with this population to really be able to facilitate better access to needed services. So it can't be a one-off. We have to have services in place that are going to be sustained and long-term, that can be in place to be able to assist these individuals with getting to the different services that they need. Because for a lot of them, again, transportation, they don't have any money. They may be secluded. They don't have a lot of friends. So what is it that we can put in place so we can have individuals who can go out into the communities and be able to assist them with taking them to a clinician or to a mental health facility where they can get the proper services that they need.